Welcome to Impact by DIFFA Dallas, the official podcast of the Dallas chapter of the Design Industries Foundation Fighting AIDS. We'll share valuable info about the fight against HIV and AIDS, what our organization is doing to assist those in our community, and most importantly, how you can help us make a real impact.
Hello, everyone. Thanks for tuning into this episode of Impact. I'm your host, Shane Allen. The title of this episode is a big one. How close are we to a cure? And to answer that question, we've brought in one of the leading experts in HIV and AIDS. We're joined today by Dr. Paul Volberding. He's the director of the UCSF AIDS Research Institute. He founded the very first outpatient clinic for people with AIDS back in 1983. He was part of the first clinical trials to come up with antiretroviral therapy. He continues that work today. Co-editor of the Journal of Acquired Immune Deficiency Syndromes, editor-in-chief of current HIV/AIDS reports, and he's the founding chair of the board of the International Antiviral Society. Dr. Paul Volberding, thank you so much for spending some time with us today.
Oh, happy to do it. And I really do appreciate the work that DIFFA has done over the decades, really, to help our work. So I'm very glad to be here.
Well, and likewise, on behalf of the entire board of DIFFA, we want to thank you for all that you continue to do and all that you've done as we look forward to our first AIDS-free generation. Before we take a peek into the future, to answer this big question of how close are we to a cure, I think it's important for us to take a look at where we started and how far we've come. So would you mind telling us a little bit about your work in the early 80s, back when we were still calling it grids?
Yeah. Well, I saw my first patient on July 1st, 1981, which was pretty much exactly when the very first reports were starting to come out about this new mystery. And it's easy to forget it now. We'd like to forget it, but in the early years of the epidemic, this was a completely fatal disease. Everyone that became at all symptomatic died of the disease. It's the most fatal infection that we've ever seen. And a lot of our early work was just, what's going on. It reminds me of what we hear now with COVID, where there's new developments all of the time. Questions that were raised as we started seeing patients. But then as we learned about the virus and the scientists in the lab really started digging into this thing, we were able to come up with some treatments that eventually really turned this around.
I talk to a lot of people about HIV and AIDS with the work that I do in DIFFA, and I feel like the layman's timeline since the early 80s until now is AIDS was discovered. A lot of people died from it. Yep. A lot. There were antiretroviral therapies created. In the beginning, they weren't so great as far as how people felt. Then they got better. Now we have PrEP, and things are okay. But things are not okay. And as you look past through your timeline, being just in the trenches, deeply involved in HIV and AIDS research, what are your kind of peaks and valleys as we've gone over the years?
Yeah, so the valleys were as we started to have antiviral drugs, but before they really became effective. There was a glimmer of hope, but still people were dying, and those were some pretty bad days. I'd say 1992, 93, 94. 1996 was the peak, really. That's when we first discovered really effective combination treatments, which we still are using today. Not the same drugs, but we found that combining 3 drugs was really able to stop the virus in its tracks and allow people to actually even get better. Before that, our treatments just slowed things down a little bit. So that was a high moment. But because this is non-curable, means that people have to take drugs every day the rest of their lives. And what we've learned over time is that even drugs that look quite safe and effective sometimes after long-term use, end up having side effects, sometimes really pretty devastating side effects. And so our goal has been to continue to develop drugs that are more potent and have fewer side effects. But we still worry because people still have to take these drugs for the rest of their lives. So that's what's driving our hope for a cure.
Yeah, there was a lot of hopelessness in the 80s and early 90s. People were attending multiple funerals a week, sometimes multiple a day. At any point, did you ever feel hopeless? Did you ever think, I don't know if if this is ever going to get better?
Well, I it's hard to remember sometimes, but I don't think I ever gave up on this. I stayed very involved throughout my whole career because we were still making progress, even though the outcome was until more recently was horrible. We were still making progress, and so that was good. That kept us going. I think being so close to the research and seeing the progress that the scientists were making and understanding the virus, understanding the immune system was a big part of what kept our hopes alive, even at a pretty bleak time. We got discouraged for sure. We lost all of our patients, and you take care of a young person. I was young at the time, and you become attached to them, and one after another they died, and so what we have today is just a very different situation, but there's still a lot of work to do.
Right. And that leads me to the big question: how close are we to a cure?
I'd say we're farther than we were about 6 months ago, because in the interval we've seen the pandemic, coronavirus emerge, and it's another epidemic like HIV, but it's different in so many ways, and it's required that a lot of the same people that have been working with HIV and that virus have shifted their attention to COVID. And so I think, and most universities basically shut down all research programs when the shelter-in-place, work from home edicts came out. So our university shut down essentially all of our HIV cure research, as did most others. And a lot of those people haven't come back yet to cure research because they're still trying to grapple with the coronavirus. So we're kind of stuck in place a little bit, although I think it's starting to turn around. We're starting to see some trials come back looking at HIV cure. I think we're still a long ways from a cure, but we understand the virus better than we used to. We understand the reservoir, the pool of virus that's still in the body better than we used to, and I think we have to be optimistic. We saw another possible cure reported, a patient from Brazil. So each one of those gives us some reason to keep our attention focused.
Yeah, those are definitely glimmers of hope as we look forward to that first AIDS-free generation. Further than we were 6 months ago. So how close were we in January of 2020, and how much time have we lost in this?
Well, it's hard to quantitate that, obviously, and I don't know how, in fact, close we were to a cure in January, but there was a good head of steam up. People were working, big collaborative groups around the world were working on this problem, and they're still intact. The people are still working on this, but I look forward to the day when we can all kind of get back to work, and we can see kind of where we stand again. There's a clinical trial that we hope is starting soon in San Francisco that was the culmination of an attempt to combine the different promising directions in cure research. That will be a small trial, but a very aggressive one. And I think it's trials like that that'll tell us over the next year or so whether we have some of the elements that we might combine into a cure. Now, what we ultimately would like, obviously, is a very simple approach to cure. We would like just a pill to take to get rid of this virus. That's the holy grail. And I think we're a long ways from that. But if we can get to the point where we can reliably reduce the reservoir, that will give us then really a lot of momentum to keep at finding a cure.
Do you think we'll see one in your lifetime, in my lifetime?
Well, it depends on me and the coronavirus at this point. I'm 71. So I hope so. Sure, I do. And yeah, I mean, if I live to, a riper old age, and if we keep the momentum going, I'm very hopeful. Sure. I'm a very hopeful person. Have to be.
Is it possible that what we have now, which is a mixture of antiretroviral therapy that get people to undetectable, and those who don't have HIV, who are on PrEP, is it possible that this is our answer? That increasing PrEP use and continuing antiretroviral therapy of those who have acquired HIV, could that ultimately lead us to just an eradication over time?
Sure. So if we don't look for a cure, we won't find a cure. But short of a cure, we've made such incredible progress. I mean, no one would like to take pills all the time, either to treat or prevent this infection. Right. On the other hand, the fact that you can take a pill a day to both treat and prevent this infection is sure a lot farther than we were, 20 years ago. And we know that, treatment works. We have a number of single pill treatments that almost always block the virus, to the point where we talk about U equals U, undetectable equals untransmissible. So that means that, a pill a day, and now perhaps even long-term injectable treatments can allow the virus to be suppressed, can allow the immune system to recover, and can prevent transmission. So those are great. And we know that PrEP, and including now PrEP with long-term injectables, so you might have a PrEP injection once every 2 months. We know that can really almost completely prevent getting infected if you're uninfected. So the combination of those two things means that we can, drive this disease back underground, if you will, but it doesn't mean the virus will go away from the population. For that, we would really, I think, need cures and hopefully an effective vaccine.
We've talked earlier about that case in Brazil of a possible cure. That's just one person.
Right.
Obviously, most everyone who acquires HIV will die with it, not from it.
Right.
PrEP has a 99% positivity rate, or 99% effective rate in preventing the transmission of HIV. 9 out of 10 gay and bisexual men know about PrEP. Unfortunately, only 35% of them use it. With all of those things that we have, all these tools that we have, all this information, these glimmers of hope, that case in Brazil, what's the most promising thing for you right now?
Well, I think that to me, the most promising thing is that we have the tools, as you said, and the tools that we have, the medicines, whether it's oral or injectable medicines, have gotten better and better, both in terms of how potent they are and the reduction in side effects. So we have the tools. So to me, the most important thing is how do we implement it? As you said, we know that there's a large group of people who are at risk of getting infected who aren't on PrEP. So what can we do to understand better who they are, how to communicate with those people to help them decide to be on PrEP, and to make sure there are no barriers to them receiving it, either financial or social stigma barriers. So those are not sexy, bench science, but they're really important implementation science. And so to me, that's where a lot of our effort really needs to be headed. And we were, again, until the COVID thing happened, we were really talking about ending the epidemic by applying those tools. And I would love to see us get back and start talking about ending the epidemic again. Even if we've got this other pandemic going on, I think we realize that HIV remains a really important problem. And it's been encouraging that there's been more talk about that, about the challenge of keeping our attention focused on HIV, its co-travelers, TB and malaria, because globally those three infections are just devastating. And I think we do have the tools to slow them down.
Yeah, and that's one of the reasons that we've continued these episodes of our video podcast, is because rightfully so, there's a lot of COVID-19 information out there, but HIV/AIDS is still something that still exists and something we need to continue to talk about. And by talking about it, hopefully we help reduce that stigma by making it such a normal conversation to have.
And it's an infection you don't get over. COVID. I mean, I do not want it, and I think it's just devastating the world. But remember that this virus, HIV, is one that we generally can't cure. It doesn't go away on its own. You don't develop spontaneous natural immunity against it. And so it remains a really important target globally as well as domestically.
What do you think is, or is there anything that people are not talking about as it relates to HIV and AIDS that's important to be talking about, or important for people to know that is just not common knowledge, perhaps?
Well, I mean, a lot, but I think one of the most important challenges that we have now is that people look like they're not even being tested as much. Again, I think because of distraction of the other things that are going on. And so I think we need people to still be reminded about HIV. And I think people do pretty well understand that it's generally not curable. I think people generally understand that our treatments are effective, but I think we could do a better job of spreading that message. Even here in our own country, there are many people that for a lot of reasons are still not really involved in addressing their HIV infection. That's a big challenge.
Why do you think that is?
Well, we talk about stigma a lot, and I think it's often stigma. We sense it, especially in young Black gay men, where the combination of things might lead them to feel stigmatized, less willing to kind of come out with their concerns. So I think that's a big challenge. I think the fact that this epidemic is focused often in really fairly rural minority communities, people that have a lot of barriers to care, states that haven't done Medicaid expansion, people living remotely from HIV knowledgeable providers. Really huge practical issues that as a society, I think it's important that we get back to addressing.
Yeah, that's a great point. We could talk. I feel like I could talk to you for hours, but I want to be as respectful of your time as possible. Thank you so much for spending some time with us today. Delighted,
and I look forward to seeing the podcast.
I look forward to you seeing it, and perhaps we can do this again sometime.
All right, great. Nice talking.
Thanks for watching, everyone. You can learn more about what DIFFA does and about the AIDS service organizations that we serve at diffadallas.org.